2DG is considered a novel agent to a degree. The funny thing is it's been used 60, 70 years ago in some of the earlier studies to block glucose uptake in cancer cells. It's not very expensive. Nobody, as far as I know, nobody owns it. And there's another substance similar to that, it's called DCA. And these drugs that no one owns that are pretty cheap create problems when you're trying to study them because there's no money to be made, so who wants to fund a study with a very cheap drug? So that's the annoying part about it. The good part about it is, again, it's a cheap drug, so these studies are going to come along at some point. But yeah, it does a couple things. It blocks glucose uptake, blocks hexokinase. It in itself can induce ketosis. It mimics a fasting, calorie restriction, ketogenic diet type state for those people that are not in ketogenesis. It induces autophagy, which is when our cells start to pick off their faulty parts, like our innate recycling program. So some people have discussed 2DG for neuronal autophagy, and by that I mean reducing the risk of Parkinson's or Alzheimer's, basically getting rid of the junk that accumulates in the cells in our brain. So it does a lot of things that the ketogenic diet does. The one thing that I think the role it plays with the ketogenic diet is, since it's going to block glucose uptake, using ketones as a source of energy may be kind of the escape mechanism. So it's one of the biggest side effects of it may be mitigated by putting someone on a ketogenic diet, or even maybe just giving them exogenous ketones. We don't really know. So that's basically the gist of the study I'm trying to get through. And I'm fine saying that in the open, because if I don't do it, I hope somebody does it. It's just a study that needs to happen. So if somebody wants to combine with me and they have funding, I will gift them my study. So email me.